there. Today we are speaking with Dr. Tyler Turbak. Tyler is a physical therapist here at Prairie Lakes Rehab. Welcome, Tyler.
Thank you for having me.
So today we're going to be talking about sports medicine.
Sure.
So tell me a little bit about yourself and your background.
Sure. So like you said, I have my doctorate in physical therapy, which means I went to school at USD for 4 years. I achieved my bachelor's in science and psychology. From there, went through the application process and was accepted at USD's physical therapy school, which is housed within the School of Medicine and over in the athletic complex. From there, it's a 3-year rigorous program. So all in all, 7 years of schooling after that. Fortunately, graduated with my doctorate degree and have been practicing now just about 3.5 years.
Wow, time has flown by. I remember when you started.
Yeah, we started right around the same time.
Yeah. So tell me a little bit about the sports medicine piece of your work. You know, I know the athletic trainers here at Watertown High School, they're a part of the Prairie Lakes Rehab team. How does that collaboration work between you?
Sure. So for a while there was kind of an unknown of who to go to, who was in charge of what. We had a great athletic trainer, Michelle Lighthizer, doing her best with kind of some limited resources. She was spread pretty thin between all of the varsity sports, being housed in different locations all around town, really. So this last fall, we were fortunate to bring on another athletic trainer. I'm a graduate from SDSU. Jeff Hofschild is his name, and he's just been a great member of the team. He has taken the load off Michelle's shoulders considerably. They were able to kind of divvy out and delegate who goes to what events, and it made each of them, I think they have to be much happier with their job and more satisfied and more accommodating for their work-life balance as well. So, and then that kind of helps us in a sense too, because they are a part of our team where if they have someone who, you know, their injuries aren't getting better or they're always injured or there's different things going on where we're a good referral source for them. They can say, hey, if you've got some time, do you mind swinging by the high school and seeing so-and-so in the training room? I'm kind of stuck. And so we work really well together and we can just hopefully keep those athletes healthy and keep them competitive.
Right. So together you're really working on preventing injury and helping them gain strength, flexibility, that sort of thing.
Certainly. So the injury prevention part is kind of a trendy topic. You know, a lot of healthcare is we react. You know, if someone gets hurt, then we react and do the rehab after that. Well, obviously, if we can prevent that injury, then we can save that athlete the mental and physical strain. We can keep them competitive on the court with their team. And so we have implemented some injury prevention type stuff as well, even dating back as far as March of, I think, 2017. My colleague, Dr. Eric Feldheim, and I started what we called ACL Camp. You care if we kind of elaborate on that a little bit? Is that all right?
Go ahead.
So ACL Camp, ACL standing for the ligament of the knee, the anterior cruciate ligament. But CAMP is kind of an acronym for Coaching Athletes Movement Principles. Okay, so what that really comes down to is we break down movement into very basic things such as squats, lunges, and just get very basic foundation stuff, build strength in that foundation. From there we build into balance and plyometrics and agility type activities, and those programs have been shown to be quite successful in preventing those injuries from occurring. And it's not just based on our professional opinion, it's been researched by literature, quite extensive literature really, for coming out of Europe and the US, combination of stuff. Professional soccer is a huge one. Most people have heard of FIFA soccer. It's an international thing where they put together an extensive group of things you should address for injury prevention.
Right. So for ACL Camp specifically, you're looking at middle school, high school.
Yep.
What kind of age group?
That's right. So boys and girls both. There is more literature on females. They just happen to be a little bit more prone to injury when it comes to specifically the knee, but it's good for both males and females. Kind of the 7th and 8th grade, as early as that. 7th grade, they're still kind of skeletally immature a little bit, so we do tend to lean more from the 8th through 12th grade. And we've done it a little bit different now that we have the athletic trainers, because we've kind of handed the baton to them and we've allowed them to have a little more structure with the athletes. That way Eric and I aren't being pulled from the clinic. Mm-hmm. That way they're able to do it and deliver it at the school, get a little bit better compliance, a little bit better attendance that way too.
Right. So let's say the unthinkable happens. I'm an athlete and I tear my ACL.
Sure.
What's kind of the process that happens with that?
Yeah, it's a great question. So it's a long, lengthy process, not just physically, but emotionally and different things like that. If you're let's say, what grade in high school are you in when this injury occurred?
Let's say 10th.
Okay, you're a 10th grader,
Yep.
so you're pretty fortunate in that sense. Depending on what season you tore that in, chances are you're going to miss a full year of sports participation. Okay, that hearing, most patients hearing that is kind of a shocker.
Right.
And the reason for that, again, isn't based just on my opinion. That is based on scientific literature that says, hey, by the way the body heals, the way the graft heals, and all these different things, the maturity of the harvest site and all these things needs at least 9 months to be the earliest you should return them. There's some that are saying even as far out as 2 years. You should wait 2 years before returning to a sport. Or if you're a college athlete, heck, you're basically losing half of your eligibility. A high school student, a 10th grader, you're going to miss all of your 10th grade and all of your 11th grade year if you wait those 2 years. But as far as the process goes, you would have a consultation with an orthopedic surgeon. They would obviously go through different options with you. The options that you would need to select and they would be able to recommend would be, what type of graft are you going to use? Okay, that's not something that you necessarily, as the patient, would have much choice in. You would have the choice, but the surgeon would make their recommendation. Mm-hmm. The most common graft choice for a young athlete would be to use a portion of the patellar tendon. So patellar tendon is from the kneecap that attaches to our shin bone. They take the middle portion of that out and use that tendon to now become the ligament in the knee. Okay. The other two graft choices, it is crazy, and I've watched the harvesting and the reimplantation of that, and so it's quite a humbling thing to watch them go through that process. Some other common graft choices that we see locally are the hamstring. They take a portion of one of your hamstrings and are able to use that tendon and create a ligament that way. Some newer ones, it's pretty uncommon, but they actually use the patellar tendon from the opposite knee. Okay, and so the reason for that is then you have less trauma on the surgically repaired knee, but then at the same time you're kind of recovering from 2 surgeries. But another more revolutionary one they're using is the quad tendon, so the quad or top thigh muscle, the quad tendon, and they're able also to use what are called allografts, which means they come from cadavers. So I've had numerous patients who have a patellar tendon or a hamstring tendon that was harvested from a cadaver.
Interesting.
So that's another interesting topic that patients, and the benefit of that is then you're not having that second harvest site. Mm-hmm. So if they take my own hamstring, not only am I recovering from that, but also the knee surgery itself. Right. Or if you take a donor tendon or a ligament, then you have a little bit less recovery, but the strength is different, and there's all kinds of things that go into thought with that.
Right. That could be a whole nother topic. Very
That's
interesting.
Exactly right. Yeah. That's exactly right. So that's just the pre-surgery type stuff. Mm-hmm. Then you'll have the surgery, which would last anywhere, I suppose, an hour to 2 hour long surgery, depending on complications. It also could be complicated if there's other damage within the knee, if the meniscus or other ligaments that are injured. There's a lot of things that the MRI scan may not be able to identify. And the MRI scan would happen before the consultation with the orthopedic surgeon. So, I mean, there's all kinds of timeline stuff that goes on. But then the recovery phase really starts as early as a week from surgery. I mean, you start trying to get muscles warmed up, manage swelling, manage pain, try to get you to start walking with a brace on, and there's all kinds of stepwise things. But long story short, anywhere from 9 to 12 months you can expect for recovery before you're getting back into sport.
Wow.
Yeah.
So they come to rehab to recover, right?
That's right.
Regain that strength. Talk about that process a little bit. I mean, not in just with recovering from an ACL tear and surgery,
Sure,
but day-to-day life.
Sure. So even we'll start with the ACL, and I kind of made mention of it. You just really have to get muscles used to doing their work again. Mm-hmm. There are certain restrictions depending on how complicated the surgery was on what we're allowed to do, just because we don't want to overstrain tissues that are sensitive and healing yet. But just in an everyday patient, it always comes off based off of what the assessment that you performed with them going back to day one. If it's just a gentleman or a female who comes in with knee pain, and you do an assessment and you realize there's maybe some muscles that are a little bit weaker or muscles that need some addressing because they're sensitive or need some flexibility, that really dictates what you go off of. Not every knee patient is treated the exact same, and I think some patients are kind of surprised by that. I've been to this PT before. What are you going to offer that's different? Well, maybe we have different opinions on how to handle your type of situation,
Right.
and and whether it's a shoulder, a knee, or a hip, or any joint really for that matter, what we work on and what we instruct the patient in doing really is based off the assessment and the examination that we do with them.
Right. So really personalizing that rehabilitation.
Absolutely.
For each patient.
Absolutely. Very individualized, and it's tailored to their goals.
Right.
If someone wants to get back to playing a sport, their goals are going to be different than someone who just wants to be able to go to summer camp or just work their job.
Right.
There's a lot of different thought that goes into that.
Exactly. So what else do you have on the topic of sports medicine?
Let's see. Sports medicine. It's kind of an umbrella term, but it kind of factors in different parts of our team as well. The orthopedic surgeons, although from a different entity, Glacial Lakes, they do a phenomenal job of taking care of our athletes, not just for Watertown, but the surrounding schools as well. I had the opportunity to go with Dr. Casey Johnston and do a couple Hamlin football games where we were on the sideline doing venue coverage for that. That was kind of neat to see the live action stuff and be able to take care of those athletes right there on the spot rather than the reactive type stuff. We could work with them right there. When Eric and I first started working, we were the sideline venue coverage for Watertown soccer teams.
Mm-hmm.
And so that was about 3-4 times a month we were at the venue helping athletes, pre-game, whether it was ankle taping or helping them get stretched, get loose, taking them through injury prevention programming. And then again, treating those athletes as they became injured on the field, or maybe they're cramping and they need someone to help them get some fluids in and then help them get ready to get back onto the field. Sports medicine we've taken a little bit different stance, Eric and I, just because we have the luxury of having those two athletic trainers. And so more or less now we just kind of work with them, work through them. If they're both ill or if they're gone, then Eric and I would be more than willing and able to step up and take their place for an event if the need would be there. But in order to be a sports medicine provider, to be at a venue, there is I shouldn't say extensive, but there's a course that you need to go through to know how to obviously perform CPR and apply an AED, just the basic CPR, life-saving skills. But also, how long do people need to be in shelter if there's a thunderstorm? How do you handle a bee sting? How do you handle, these more the things that can occur in the outdoors that you don't necessarily attribute? What if there is a massive casualty or triage type thing? You need to be able to handle those types of situations, not just that person's injured, I'm going to go care for them. You need to know how to handle, crowd control and if they're, like I said, if there's severe weather, how long do people need to be in shelter before they can resume play and be able to handle those type of situations as well.
Interesting.
Yeah.
So you have a broad base of knowledge, a variety of things you're expert in. So thanks so much for coming here and talking with us today. Is there anything else you want to include?
I can't think of anything right now.
All right. Well, if you have any questions for Tyler, you can call Prairie Lakes Rehab at 882-7700 or look up Prairie Lakes Rehab at prairielakes.com. Thanks again.
Thanks a lot.